Continuing on with collecting the evidence. To review the Module 5 goals about getting your data and what your data can do for you, we've talked about the population, defining your population, and determining the kinds of inferences that can be made, and that you are restricted to making inference that is associated with the sample that you've drawn from your population. You've determined your sample or figured out how to determine your sample, and we talked about different types of sampling strategies. So what about the study design? What are observational and experimental study designs? And how do those apply to collecting your data? The two most common study designs are experimental or observational. And how do you select that design? Experimental are studies designed that test a factor and measure the outcome. So they could be testing a drug, a device, or a behavior. For example, does this new drug work better than the old drug? Does this new surgery work better than physical therapy? Does this new pacemaker work better than an older version of that pacemaker? Does this smoking cessation behavioral modification work better than simply literature review of results of smoking? So you're testing a factor and then measuring a change or measuring an outcome. Common designs are pre-post. So you may measure someone's systolic blood pressure, then put them on an exercise regime, and then measure their blood pressure again. And if you had people doing one type of exercise versus another type of exercise, you may compare the change between those two groups. These are often interventional studies, so trying to see what prevents something from happening, prevent people from getting worse, or helping people get better. These often include randomization. That is when people volunteer to be in a study and they don't know which intervention or which modification they'll be assigned to. Sometimes they know because it's hard to hide, but in other times they may be given a placebo versus an active drug. So what types of designs go with experimental? Experimental versus control groups, active treatments versus placebo treatments, new treatments versus standard treatments. And of course, it could be multiple arms. You could be looking at drug A versus drug B versus people who take both drug A and drug B at the same time. The key attributes to experimental designs is that they almost always include randomization. This allows for balanced groups in terms of characteristics like demographic and disease. You wouldn't want only women taking drug A and only men taking drug B, because then you would never be able to tell if your difference in outcome is from the drug or from the gender of the participant. Experimental designs have a timing of the intervention, so you measure the outcome, implement the intervention, and then measure the outcome again. They're usually longitudinal and prospective, meaning that participants are followed from a specific time point forward, and they can draw causation. Experimental studies are not always possible. Oftentimes, observational studies are either more convenient or the only possible way to collect data. This is when you directly observe measures with a survey or medical records, and you collect data on the environment or a process occurring. These are often called cohort designs or case control designs, and they are not randomized. That is, there is no intervention that you are applying to comparator groups. You are following people either in their natural state of being, or you're having everyone do the same thing or select their own option and following them to see what happens. Some common examples are the Regards study. Regards is a population-based racial and geographic differences in stroke study. The Youth Risk Behavior Survey, so surveying younger participants who are at risk of behavior. And Homeless and Hungry, looking at homelessness and food insecurity. across college students in a national study. These are observational. In the regards stroke, there are no specific medications or interventions being done to prevent stroke. They're simply following people to determine if they have a stroke. Youth Risk Behavior Survey, there are no interventions being done to intervene in risk for alcohol or drug use. They're simply asking people about those risk behaviors. Homeless and hungry, there's no intervention being done to limit homelessness or to prevent homelessness, or there's no food being provided or no assistance being provided towards that. It's simply surveying insecurities around homelessness and hunger or food issues in college-age students. The key elements with observational examples is that they are much easier to implement than randomized controlled trials, but they are harder in terms of showing causality, saying that this factor causes this outcome. How do you select the type of design? If you're looking to say this factor causes this outcome, that is an experimental design. If you're looking to say what happens to people under these circumstances, then that is an observational study. Both have their place, and in some cases, observational studies are not possible. For example, you would never randomize people to be in a car accident wearing a seatbelt versus not wearing a seatbelt. You would never look to be treating drug addiction by randomizing people to take drugs versus people to not take drugs. Some studies are only observational, and that's okay. Observational studies, particularly long-term observational cohort studies, can provide a lot of evidence and may even be able to provide causational evidence. So when exactly can we say that this factor causes that outcome? In order to demonstrate causation, you need to know the exposure time. So if you are looking at, say, benzene exposure and cancer and development of cancer, you need to precisely know the exposure time to benzene. You also need to be able to precisely measure the outcome and when that outcome occurred. And there needs to be a temporal association between exposure and outcome. There also needs to be a correlation between the two. So higher exposure leads to worse outcomes. And there needs to be no other plausible alternative. So is there another reason that someone could have developed cancer, or that all of the people you're studying could have developed cancer other than this benzene exposure? For example, if everyone in your group had benzene exposure but is also a smoker, determining that smoking caused the cancer or benzene caused the cancer would be very difficult. So you need to have very tightly controlled, experimental, generally, guidelines and design for causation. So to review, it's time, association, and reasonableness of the relationship. It is incredibly important that correlation alone does not lead to causation. That you understand that correlation and causation are not the same thing. Two things can be related, but unless they adhere to the general guidelines for causation, correlation alone does not deem that this factor causes this outcome. Hill's criteria are specific rules to establish a causal relationship. Again, this is hard to do with observational data, but not impossible. There are 10 Hill's criteria: strength, consistency, specificity, temporality, dose response, plausibility, coherence, experimental evidence, analogy, and reversibility. Remember, experimental evidence is not required. If 9 of these are met and experimental evidence is missing, but the strength, consistency, temporality, dose response, etc. can be shown, then you may be able to talk about causality. In any circumstance, whether it is an experimental design or an observational study, it is incredibly critical to know that we never prove anything in statistics. We never prove a null or alternative hypothesis, and we never definitively prove a relationship. We have evidence to show or conclude that there is a relationship between these two factors. Collecting the evidence, how you collect the evidence, from whom you collect the evidence, or on what you collect the evidence, is the critical component to utilizing statistics to support public health research and decisions about public health. Continuing on with the activity, answer the questions regarding the team project with respect to the population and your sample.